Okay, so hello everyone. I'm Pratap Pandya. I am a clinical associate at the Cleveland Clinic, and I'm a social media ambassador for the Critical Care Cardiology, as you can see. And we have our guest today with us, who has agreed to give us a short interview and talk with us for the regarding the field. Dr. Randy, he's at Cleveland Clinic and Critical Care Cardiologist. Thank you so much, Dr. Lee, for agreeing for this. And this is a short session. I just wanted to get your views on about the field to begin with, since it's a relatively new field. We don't have as many specialists in this field as we have in other specialties, and there is a lot of interest from the incoming generation and the trainees like me and others who are looking forward to leaders like you in the field and experts. So, how do you see this field as a future, and what would you advise to the future trainees in this field?
Thank you for having me. Thank you for giving me the opportunity to talk about the specialty and topic that I love, cardiac critical care or critical care cardiology. Believe it or not, we are not so nascent anymore. We have our own section within the American College of Cardiology. We have a professional home. We have inter-society collaboration with multiple other societies such as HF-ICU, ESC, AHA. And I think individuals in the profession are starting to recognize that cardiac critical care has its own place and needs its own time. We're having more and more trainees enter the field or express interest in different training pathways. Multiple papers have been published to kind of lay out the different ways you can get there. And I would say that the number of critical care cardiologists in this country are getting to be almost to the triple digits, which is exciting. As we're trying to staff, level 1 cardiac intensive care units across the country and really provide, really intensive care and really holistic care to our patients with obviously cardiac disease, but critical illness otherwise.
Sure. Thank you so much for sharing that. And a couple of things that usually, one thing I just wanted to get your views on this, since it is something with a significantly high mortality, cardiac shock, we are talking about that, and it's so much high mortality even after this many years in the or in the advances in the field to begin with. And the research opportunities, I see it as a robust opportunity in this field because there is such a lack of evidence and we need. How do you see that? I see the danger shock trial, which was just presented. We just have finally some randomized, evidence in that field. How do you see those opportunities coming up for the trainees to look forward?
Yeah, I think there are a lot of pathways already that exist for kind of growing scientific base and evidence in this field. It doesn't have to be as groundbreaking or landmark of a trial such as danger shock, which is very exciting for all of us. But the Cardiac Critical Care Trials Network, the Cardiogenic Shock Working Group, they've already started to kind of examine what's there and available in cardiac intensive care units now in the country and internationally, to really look at observational data, to really be a breeding ground to start conducting pragmatic randomized controlled trials across multiple centers. So the ICU is really rich for investigation. Intersections between different organ systems, complex lung ventilator interactions, applying different evidence bases from different specialties to cardiology and cardiac critical care. It's an exciting time, and I think the framework for more research and exploration is there.
Sure. Thank you so much for sharing that insight. One last question. I will not take much of your time at the exciting meeting that we are at to begin with. The last question I have is, usually in the trainees there is a sort of a dilemma about the future. How does it look like in the field of critical care cardiology in terms of employment, in terms of job opportunities, in terms of the work hours as well? How do you say that? If you can comment, I know it's a naive field, so there is a lot coming up. Of course, that it needs to be centralized, but still, about your views on that, if you can.
Yeah, I think several in the field now are trying to define that. It happened once upon a time where institutions may not have known what to do with a new hire coming from a critical care cardiology background. They tried to fit the new grad into existing systems, and it's incumbent upon us now as our own specialty, as our own cohort, to define what works for the specialty, for future trainees, for current critical care cardiologists, and what that looks like in terms of job description, staffing patterns, time off. Burnout is real and prevalent, and we have to address it head on. But I think the most important thing is that we're defining it for ourselves, and you'll be seeing a lot more coming up from the different societies and different committees on what is competencies for a critical care cardiologist. What are expert consensus on the ideal employment opportunities for critical care cardiologists. So we've identified that that's an area that we need to work on. But you'll see more coming soon.
Sure, that's exciting, and that's really great to know coming from you. And thank you so much, Siddhar. I really appreciate your time, and please enjoy the meeting.
Great.
Thank you so much. Thank you, everyone, for joining us.